Thank you so much, and I'd like to welcome each and every one of you to the City of Oceanside Housing Commission meeting. Today is Wednesday, September 22nd, and at this time, I am going to ask for the roll call.
Yes. Chair Williams.
Yes, ma'am.
Vice Chair Welshaw. Commissioner Whip. Commissioner Howell.
Here.
Commissioner Costa.
Here.
Commissioner Cornett.
Present.
Commissioner Keller.
Here.
Thank you. Commissioner Schout.
Present.
Thank you. And Commissioner Webster.
Here.
Thank you.
Thank you. Do we have a quorum?
We do.
Thank you so much. At this time, I would like to extend regular voting member privileges to the alternate Vanessa Webster so that she can vote on anything that we discuss on tonight. Thank you. And also, I'd like to remind those who are calling on the phone to please mute your phone by pressing *6 unless you're speaking. So for the entirety of the meeting, please mute your phone by pressing *6. And then if I call on you to speak, then please unmute your phone by pressing *6. And also would like to remind each and every one of us here tonight to please speak into your microphones so that the viewing audience will be able to hear us. Thank you so much. And so now we're going to go to our next agenda item, which is approval of the revised minutes of July 28th, 2020 of our regular meeting. Everyone should have had an opportunity to review over those minutes. Okay, so right now I am entertaining an offer for you to approval of the minutes.
Motion to approve?
Okay, so we have a motion to approve by Commissioner Cornett, and we have a second by Vice Chair Walshaw. All in favor, please indicate by saying aye.
Aye.
Any objections? Any abstentions? Motion carried. We also have the approval of minutes for the August 12th. We had a special meeting on August 12th, 2020, and I will also entertain a motion for the approval of those minutes. Do we have a motion on the floor?
I'll move to approve.
Okay, it has been properly motioned by Commissioner Cornett. Do we have a second?
I'll second.
It has been properly motioned, a second by Commissioner Howell. All in favor, please indicate by saying aye.
Aye.
Any objections? Any abstentions? Motion carried. Thank you so much. And next on the agenda, we have our City Council Liaison, Councilmember Esther Sanchez. Okay, so she's not here with us this evening, so we'll go down to audience communications. Do we have any communications? Anyone calling in on the phone for any audience communications?
We have had no phone calls or emails from constituents.
Thank you so much, and I would take it that's the same with public communications.
Thank you. No public communications.
Okay, so now we're on agenda item number 7, which we have items for the discussion and action item. And this action item is calling for the appointment of the Dr. Martin Luther King Jr. Community Service Award. And so according to our bylaws and work plan for this particular award, we should have no more than 2 commissioners and up to 7 prior recipients of the award. So at this time, we're soliciting commissioners, no more than 2, to be a part of this Community Service Award. So if you would like to be on the selection committee for the Dr. Martin Luther King Community Service Award, please speak up now.
I would.
Okay, we have Commissioner Howell.
I would like to as well. This is Commissioner Keller.
Okay, Commissioner Howell and Commissioner Keller. Okay, so I have also already spoken to members of the community. According to the work plan, just for the viewing audience, the commission shall coordinate the annual Dr. Martin Luther King Jr. Community Service Award Program and participate in appropriate celebrations around the Martin Luther King Jr. holiday in January. The commission chairperson shall appoint a Community Service Award Selection Committee comprised of 2 commissioners and up to 10 persons comprised of a representative from the North San Diego County branch of the NAACP and 7 past recipients of the award. And so I have spoken with the president, Ms. Satya Austin of the NAACP, and she has consented to be a part of this. And so at this time, I will now call off the names, and I'll call them off slow for you. I'll call off the names of the selection committee for the 2020 Dr. Martin Luther King Community Service Award. We have Ms. Janet Blesso Lacey. Again, President Satya Austin, NAACP. Commissioner Natasha Howell. Commissioner Ashley Keller. We have Mr. Max DePosti of the LGBTQ community. You got Max? M-A-X. We have Ms. Ray Clendenning. Mr. Gerald Hampton. Mr. Rick Wright. Ms. Colleen O'Hare. And Ms. Lillian Adams. And so at this time, I would like to entertain a motion to approve the 2020 Dr. Martin Luther King Community Service Award Selection Committee.
I make a motion to approve the Martin Luther King Selection Award Committee.
Okay, it has been properly motion approved by Commissioner Costa. Do we have a second? Okay, it has been properly motion and second by Vice Chair Walshaw. All in favor, please indicate by saying aye.
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 Okay, any objections? Any abstentions? Motion carried. Thank you so much. And just want to say thank you to those individuals that have consented from the community to participate and be a part of this particular program. And I'll speak a little bit more to it in my report a little later on. So we'll go to our next agenda item, number 8, and this is for information only. We're not going to be voting on anything. So we would like to have an update on the Oceanside Bridge expansion program. So if Salvador Roman can come and just give us an update on what's going on with that program.
Good evening, Housing Commission chairs and Madam Chair. I'm here to give an update on our Oceanside Bridge expansion program. It started in May 6th and it sunsetted August 31st. So as of August 31st, this program is no longer operating, but I kind of wanted to give highlights on the success of this program. So just an overview of what I'll be talking about. And I'll briefly go over bridge housing because this is an expansion of this specific program. I'll go into what exactly the bridge expansion program was and then the data that shows the success we had within the program. So I'll quickly go over this. Our bridge program is our transitional housing. The apartments were designed for our chronically homeless individuals, and it was essentially 3 units, 12 beds, The referral mechanisms were the homeless outreach team from OPD as well as the Housing Authority. The services provided at the Bridge Apartments were 24/7 on-site support, as well as housing navigation and social integration services. Now, going into the Oceanside Bridge Expansion Program, this program was designed in response to the pandemic, and it provided the bridge services that I discussed in the bridge program into a non-congregate shelter setting. So essentially what we did is we partnered with a motel, and it took collaboration from several different departments within Interfaith, different departments within the city, and other social services and nonprofits, agencies coming together in the spirit of partnerships to make this work. So the Bridge Expansion Program provided 15 rooms, and essentially we gave them food, we gave them supplies, we gave them a safe space so that our housing navigators, social workers could provide the services, and they had a safe space to work with them. The priority populations for this expansion program was homeless families with minor or dependent children, any homeless resident that was high risk for COVID-19, and homeless residents with a housing plan. So our bridge program started October 1st, and I have some the information of success as of September 1st. The residents served as of September 1st are 50 individuals, and the successful exiting to permanent housing is 70%. We currently have 18 that are in transition of getting into permanent housing, and then we have a 12% of our clients who are unsuccessful. These are some of the reasons why we had some of our residents who were unsuccessful in our in-housing plans from our expansion program. One of the reasons was one of the clients wanted to live in a boat, and they didn't want to budge other than us helping them get a boat. So we gave them assistance, we gave them leads, but that's all we could do. Another client was referred to the hospital, the VA hospital, because they needed a higher level of care. They were not able to live independently. And then 4 exited on their own for various reasons that included they didn't want to comply with the rules that were put in place for the safety of themselves and other clients. So some of the housing plans where they went was we utilized the majority of or most of our success came from the Section 8 vouchers. We had some referred to our rapid rehousing or different rapid rehousing programs. Some weren't ready for housing, and they were okay with moving into a 6-month to 12-month shelter. And others just were able to find their own and could afford on their own affordable housing. Some of the vouchers that were used for Section 8 included POFA, Project One for All, Mainstream, BUP vouchers, Family Unification, BASH, and Homeless Preference.
Could you say what those acronyms mean?
Sure. So Project One for All, those vouchers are designated for residents who meet the definition of homelessness and have are severely mentally ill. Those are the designations for those vouchers. Mainstream are those who meet the definition of having a permanent disability, and not just them, but someone in the family or in the household have a permanent disability, and are non-elderly. The FUP is Family Unification, help me out here, Angie, program, and that's working with child welfare services in reunifying families. VASHs are veteran vouchers, and the homeless preference are the ones that are referred through different homeless service providers for our chronically homeless population. So see, these are some of our performance outcomes when we're looking at the work that we do with our social workers that we have integrated into our programs. We have helped 581 individuals or residents of Oceanside. 529 of them were homeless. 30 of them were at risk, and we provided over 3,000 services to our residents. We've sheltered 96, and we've been able to provide permanent housing to 33 of our homeless residents of Oceanside. So I want to take a moment to pause and recognize that this is, these are incredible numbers. We've worked really hard, and the social workers that are on site for OPD HOT, as well as the Housing Authority, go lengths to make sure that the clients have some sort of solution, and they go and search every single avenue possible. And when we talk about the work that they do, I kind of wanted to go into some of the clinical interventions. Sometimes when working in the homeless world, they talk about case management, care coordination, assessment. This is the percentage breakdown of the work that they do as far as mental health providers. For HOT, a lot of their work is done through care coordination. That means they plug in our residents into different sorts of resources, and it's not limited to housing. Housing Authority focuses a lot on case management. And what that means is they're working with them to achieve the goal of the resident, whatever that goal is. It's not always to achieve housing, but 99% of the time, that's what our goal is to achieve, our ultimate goal. And I'll go into the services provided. This is what you guys kind of see as far as what are we doing with the resident of Oceanside that's experiencing homelessness. 25% of their work is helping them get to permanent housing. The other 75% doesn't necessarily involve directly helping with housing, but there's a lot of work that goes into providing things such as basic needs, providing referrals to mental health agencies, medicine management. So there's different avenues where our clients are being plugged in so that when they are housed, they can be successful and they keep their housing. These are the top 10 for HOT. If you notice, a lot of their information, a lot of their work is providing information, and that's because their work is to establish rapport. Their job is to make contact and wait for that umpteenth time where they're okay to receive services, where they accept, where they're willing to move forward and take the necessary steps for permanent housing. And that's all I got. Again, I want to recognize the work, and it's not just the Housing Authority, but the collaboration of different departments within the city, as well as different partners. Our program specifically for the Bridge Expansion Program was very unique. It was very challenging, but we were very successful. And the main reason why we were very successful in what we did was because everybody worked together. We all had an aligned goal, and we were able to, everybody had the main goal of getting the person into housing. We had 35 total in our motel program, and only 5 didn't make it. So that goes to show how much work was put into making sure that those that were into our program had a place to go after. I'd be happy to answer any questions.
Thank you. Do we have any questions right now for Sal? Commissioner Cornett?
Actually, just two. The first one is under Oceanside Bridge housing, you rounded up the percentages, which is fine. I just would hope that the methodology would be written on it, because I'm looking at it and I see an extra person when you do the math. So if you just can document that going forward and other things, so I know that it's been rounded up, as opposed to figuring it out. The other question that I have is on the last page, top 10 services provided. The second largest number, 9.20%, is other. So that's sort of when that's the second largest number, other can mean a bunch of things. And can you elaborate on what other is?
Yeah. So I had to clump up other, and I meant to add a slide within. You're talking about for hot, right?
Yeah.
So I meant to clump up a separate bar graph for other, because it was just broken up so much, and to show other in this graph, it just would have gone on and on. But that's the whole point of hot, right? Their job is to plug them into different resources, and it's spread all across. It ranges from DMV services to HHSA. So I apologize. I meant to add that on there, but yeah, you're right. Other is a huge category, and that's for a reason.
And that's fine. I just, when you said, well, it's because of this and this and this, that I get. It's just that when it's clumped together, it makes it difficult for me to understand it, but I appreciate that. Thank you.
Yeah, thank you for bringing that up to my attention.
Thank you. Do we
No
have
further
any-
questions. Thank you.
Thank you. Do we have any other questions at this time? Commissioner Costa?
With the bridge housing, I see that they were placed from October 1st, 2019 to September 1st, 2020. During that period of time, were they given any help that they could get back in the labor market, that they could be able to afford a home, that they could work on their own? Were they given any help other than having a place to live with a roof over their head?
Yes. So if it applied to them, mainly the clients that were referred to are bridge apartments, the bridge transitional housing, were those who were unable to live independently and needed that kind of controlled environment. But we did have clients who we did serve, and we referred over to like Salvation Army or different agencies that kind of help them be self-sustaining. One example that I have as a client we just worked with, he's 29 years old. We connected him to a service that got him a job so he can try to get his daughter back. And that's all he really cared about. It wasn't focused on housing, but that was his goal, to get a job so he can get his daughter back. And the next step would be to find a place to live so that he can have a place for his daughter to live. So we focused on getting him a job, and the next goal would be to find him housing so that his daughter has a home.
Thank you. My concern is mainly for the older gentleman who can't really work, and every time bad weather comes, he winds up with pneumonia. He's living in his car, and other people like that. I was working with a person who had a mental disease, and what they did was they put him in a room someplace, but there was nobody to supervise him taking his meds. He really needed more care than just to be. This wasn't part of the bridge. This was before that. He's going to wind up not having the help he needs. And I know there's no housing or facility for people with mental illness. So I'm wondering, what can you do to work towards that? Because there are some people that really need more help than just a roof.
Commissioner Costa, you're absolutely right. And I can tell you the steps that we've taken, and I can tell you that it's not enough, and we all always strive to do more, and we'll always strive to be better. But one of the challenges that you mentioned, and one of the things that we've seen repeatedly was we have a aging population who are have mental health issues. And one of the things that we ran across when working with MHS through our POFA vouchers was that there was an age restriction, and there's a certain age that where they no longer qualified for this program that would allow them ultimately to get permanent housing through a voucher. So we worked with them, we worked with the county to see if there's a way where we can remove that age restriction, and that's something that now the county has officially allowed MHS to do. So we have now started referring our aging population that have severe mental illnesses to MHS so that they can get that help, they can get that medicine management, and ultimately permanent housing.
Okay, thank you.
Thank you so much. Do we have any other questions at this time? Thank you so much, Sal. This was a very informative report. Thank you for putting this together for the
Thank you,
community.
guys.
Chair Williams,
So now we'll have,
excuse me.
Yes.
A fourth caller has called in, and I'd like to find out at this time if Commissioner Whip has joined
Okay.
us. Commissioner Whip, are you with us? Commissioner Whip?
Yes,
Thank you. Just wondering if you were present. Thank you very much.
are you muting him? Or did you? Okay.
yes, fine, I'm trying my best.
Thank you. Welcome, Commissioner Whip.
Yes, okay.
So now we're going to have an update on the housing strategy and request for a proposal and notice of available funding criteria by Ms. Megan Crooks.
Good evening, Honorable Chair and Housing Commissioners. Megan Crooks with the Neighborhood Services Department. I am here this evening I'm returning from your last meeting on making a recommendation for the housing strategy priority areas on August 12th to the City Council. And we did present the housing strategy areas to the City Council on September 9th. 2020, and I wanted to return with an update of what that is, and then there were comments from the Housing Commission on August, sorry, my dates are backwards, August 12th. They weren't backwards, I was correct. August 12th when we met, that you were interested in making sure there was accountability and criteria in the RFP process, so I came back to review some of that with you, and if you have any other suggestions to include in that process. So at City Council on September 9th, they did narrow down their direction to staff on what they wanted focused on with the RFP process. And that was for the priority area number 1, which includes homelessness. And this is a brief description of how it was presented. Homeless, which would be services, social workers, bridge housing, temporary sheltering, permanent housing options. And then also included in priority area 1 is extremely low income, and that would include services, rapid rehousing, permanent supportive housing. Council's direction, the motion that was approved specifically said priority area 1 with, in particular, a homeless shelter and the dynamic surrounding services and resources needed to facilitate that for the city of Oceanside. And with regard to this being a request for proposal and notice of available funding, there are different types of funding that are available that staff will call out. I'm going to give you a high level of how much this, the city does have available, but we are going to do an analysis to determine, the administrative costs for the housing, for neighborhood services, the housing division, operational costs to administer these programs and contracts as well. So we will remove funding for the administrative costs as well. The one-time funds that are available, we do have approximately $8 million in fund balance right now in the Inclusionary Housing Fund. The Housing Commission's motion was to recommend that that be restricted to $500,000. toward sheltering acquisition or development, that like city council chose not to include that in their direction to staff. So they're leaving this open for the full funding that staff puts forward. Other one-time funds we have are some low mod funds that are one-time remaining funds that we have from the old redevelopment agency, and that's approximately $1 million. Ongoing funds that we have, we receive home funds, approximately about $600,000 annually, and we can program those toward different qualifying activities. And as well, we have applied for the PLHA funds, which is, can you remind me the acronym? Thank you. I wrote it down several times. I don't know why I can't remember this one acronym. Permanent Local Housing Allocation, and that is based off of a $75 real estate transaction fee. This first year, we were estimated to get approximately $640,000 in the first year, but this will be an annual allocation that's coming forward with no anticipated end date. So we will know in future years of what those allocations will look like, but the first year is approximately $650,000. Staff did put together a 5-year proposal, which can be amended annually if necessary, but the proposal did submit to utilize those funds towards shelter or homeless activities, whether that be sheltering, housing, or services to be provided. And then there's also grant opportunities. So any other grant opportunities that might come forward, we do apply for a local or a regional grant, HEAP, and that goes towards operational costs, service providers. Currently, that's funding parts of our internal operations, as well some staffing costs, as well as our bridge program and social workers. As other grants come along, we would, of course, apply for those as well. The city of Oceanside is part of the continuum of care in the region of San Diego County, and partners can submit proposals of partnering and requesting funds that may be available through those sources as well. So for the criteria of what we're looking at and going forward with a request for proposal and notice of funding available on the homeless aspect, proposals that come forward are going to have to be responsive to our point-in-time count. It needs to resolve or work toward resolving our homeless issues in Oceanside. Currently, our point-in-time count from 2020 is stated that we have 166 individuals that are transitionally sheltered, and that might be through project-based vouchers or beds taken in North County shelters, as well as the Women's Resource Center here in Oceanside, as well as 242 homeless individuals that are unsheltered. Those are the numbers from the count. So it doesn't mean that every single head did get counted, but those are the numbers that we'd be working towards. Any work toward any number is going to be progress moving forward. But proposals will need to be responsive to that. How are they going to help resolve those numbers here in Oceanside? The eligible programs and projects, one, we'll take proposals from nonprofits, for-profits, service providers, developers, a team of all of those said. Collaborative proposals are welcome. The eligible programs and projects would be services that are going to provide the care coordination to bring homeless off of the streets, sheltering, whether it be transitional or emergency, the placement into permanent housing from the sheltering component, and then those supportive care services that are needed on a continual basis to ensure that somebody remains housed. And then the services as well as projects, whether they're development or rehabilitation of a location in order to house these types of services, the sheltering, housing, the supportive housing. Once somebody moves out of a shelter, we need to know that they're going to have a housing place to go to. And then daytime services that may be available, transportation services, anything that may be available to make the proposal work toward resolving the homeless issues for the individuals as well as for the city of Oceanside. Demographics are going to be looked at. What is the Oceanside population that will be served by the proposal? And that means, are they looking at a specific demographic? Is it women with children? Is it seniors? Is it single men? Is it single women? Is it youth? They need to make sure that the proposals are responsive to the homeless population that we're seeing is chronic in Oceanside. And then are they low barrier, high barrier? And how is all of that going to apply to the funding sources available? So some of our funding sources have requirements. And so in order to qualify for the funding, they're going to have to make proposals that fit those criteria as well. And those will be delineated in the RFP. They're going to have to discuss their locations that they're proposing. They're going to have to give a locality justification. So why are they proposing that location? Why is that good for the type of service that they're providing or the type of housing or sheltering that they're providing? Why is that functionally going to work within the city of Oceanside? And then what is the impact to the community? Is there an impact to residents in the residential community? Is there an impact to the businesses? These may be negative impacts that they're going to have to tell us how they would mitigate those or lessen them. Or are these positive impacts that they're making to the community based on their location? So as well, they're going to have to address their policies. So do they have and what is their safety policy, their security policies, and then their operational plans? They're going to have to address those things in their request for proposal and notice of funding available. Those are going to be some of the main criteria that we're looking at. And then, of course, the local partnership, the collaboration, who are they working with, and the sustainability of the programs. Now, for the extremely low-income households, we're looking with this target population more on preventative issues and then also the permanent housing options. One, are they a collaborative project? So you take the two, the homeless and the extremely low income, you may be able to have, a combined project there. Is it collaborative? Are they working with current providers that are already within the city of Oceanside? Are they working with another project proposal that's coming in? What is the demographic served, and is that meeting one of our high need demographics that need services and housing? For affordable housing units, they're going to need to address in a proposal how they are making sure that Oceanside residents have a preference for those housing options. A lot of the time when you have an affordable housing project develop, there isn't a criteria that, the new occupants of that housing project are residents from the city of Oceanside. So how are they going to address that in this proposal? Eligible programs and projects would be housing developments, it would be prevention programs, services, and then the wraparound services that may come with an affordable housing project, such as childcare or job training or other services that can help people become self-sufficient. And then are those program services and projects eligible for the funding as well for that criteria? And then what is the location? And again, the locality justification of why that location is good for the type of housing project or service that they're providing. So those are the main areas that we're looking at for a request for proposal and notice of funding available. I'm available for any comments or questions and any suggestions you might have on what we should include in this process.
Thank you so much for your report, Ms. Megan Crooks. Do we have any questions at this time for Megan? Okay, Vice Chair Walshaw?
Sorry. Hi, Megan.
Hi.
I was just, correct me if I'm wrong, but if it's my understanding when we did Mission Cove that if there's federal grants and funding involved, then the housing, when it is opened, it has to be on a first-come, first-served basis. And it's not restricted to just Oceanside residents that need housing. It has to be opened up to everyone from outside the area. Is that right?
I'm sorry, Commissioner, Vice Chair Walshaw and Commission, I don't know specifically, and Angie may have experience with that particular project. I wasn't part of that. However, the idea is to address it in the
Right.
proposal. So, if the funding is requiring you to open it up, there's not a lot of
Yeah,
leeway we can-
I was wondering if there had been, since then, if we had come up with any kind of a solution so that we could direct it to the people that we have on the waiting list already as a priority.
They can request that project-based vouchers be available, and I did leave that out as a funding source, didn't I? That project-based vouchers is also another option for ongoing funding sources. So if we have project-based vouchers as part of the funding, and we will, they can be requesting that, and then they will pull off of our list, and we will be able to maintain that wait list, and we will know that they're Oceanside residents. So,
Okay,
But
okay.
again, the point is to address it on how that's going to work or not based on the funding available.
Okay, thank you.
Okay, do we have any other questions? So I actually have a couple questions for you, Megan. For the report that you gave us about the funding and the funding that's available, do you actually have a breakdown of how the money was spent, how it's been expended? Like, we got a breakdown for the bridge housing. Does the City of Oceanside Housing Authority actually give a breakdown as to how the money is being spent? Like, we gave this agency this much money, we gave this agency this much money, we helped out this many people, and they received this much money.
Chair Williams and Commission, as far as how our current budget is being spent, yes, we do have that, and we can do that. So we can provide that to you at a future meeting with a report. But I don't have that breakdown
Right.
right
So if we
here
can
right now,
just
yeah.
put that on agenda for the next meeting that we have, to be able to get a breakdown of how the funds are being spent here at the Housing Authority, so the community can really get an idea of the individuals that we're helping and how much money we're spending to help the individuals
Yes,
in the community. Okay? And the next question, in terms of taking proposals, and so this is for other organizations that are outside of Oceanside as well, but service Oceanside residents?
Chair Williams and Commission, yes. So any operator, service providers, nonprofit service providers, they may be based out of another jurisdiction, but they can provide services here. They don't have to make a home base here. They can be developers. And they may be partners that we're already partnering with, and they may be new partners. They may be somebody that we've worked with in the past, but not necessarily currently. We're open for all of those proposals, yes.
And when is the deadline that you're looking for the proposals?
We haven't set a deadline yet because we need to see when this will get out the door, and thank you for that question. Once we do have the details of the RFP written up, I do want to work with our planning division and make sure that they take a look at it, and if there's any pertinent information that should get included in there based on land use and, any other regulations that should be considered in the proposal get included in there, and make sure that we're thorough about that. So I'd like to see it get out the door in the next 2 to 3 weeks, and then I would say we're looking at least at, I would like to give it 60 days at least for a turnaround. That gives agencies the time to partner, and if they want to look at any potential locations and try to secure those locations if they need to. That gives that time to do so.
And last question, you said that they can contact you. How? Can you please give your contact information?
Yes, they can contact me if there are any questions, mcrooks@oceansideca.org. Of course, the RFP will get posted on our website, and we will make an announcement. We also have quite a list of partners and developers and homeless providers and service agencies that we will send it directly out to, and we will put it on our bidding, the e-bid board where lots of agencies can access it. And we will make that announcement. We'll have all contact information in there at the time.
All right, thank you. Do we have any other questions for Ms. Megan at this time? Thank you so much for your report. And let's see, are you coming back? Did you have a question, Commissioner? Okay. Let's see here. What's next on our agenda? Are you still up, Megan? No? Thank you so much. So now we're going to move to our next agenda item, and we're going to have Ms. Angie Hannafin to come forth and do a report on our senior housing and wait list for our seniors. And she's going to also do her housing report and a report for the Veterans Administration, an update.
Thanks, Terry. Good evening, Chair Williams and members of the Commission. I'm Angie Hannafin with the Neighborhood Services Department, and what I'd like to go over with you now, I guess I can take my mask off, is a request that you had from a previous meeting to provide additional information on senior affordable housing within the city. We do have a number of projects, but as was mentioned by some of the commissioners, many of them have waiting lists and the waiting lists are closed. So our staff did a survey of the various properties within the city of Oceanside that serve seniors, and here's the list of them, but I did want to go over some things with you. The way each of the properties works varies significantly. There's 3 projects that are HUD-funded projects whereby the property owners have a direct contract with HUD. Those are more desirable for seniors because they're based on the seniors paying 30% of their income towards the rent. So I'll go over that in just a minute. The others are affordable, but for some folks, especially some seniors with extremely low income, they would not be affordable. For example, Cape Cod Apartments, their lowest rent is around $830 a month. So for a senior who had, say, $1,000 a month, that still would be difficult. At that particular property, we have 16 Section 8 participants living. So these are the stats that we came up with. The Cape Cod Apartments actually have a few vacancies right now, unlike many of the others. But as you can see here, Lil Jackson Senior Community, that's located over off of El Camino Real. Lake, excuse me, it's Lake, you're right, Lake. It's on Lake Boulevard. That's one of our newest senior properties. They've got quite a waiting list. Mission Cove Seniors has 138 units with 1,500 on the waiting list. Silvercrest is a property also on Lake that's operated by the Salvation Army, and their waiting list is open. Vintage Point 1 and Vintage Point 2 are 2 fairly large tax credit senior properties that have been open for about 15 to 20 years. They're located on Bush Street, and they both have waiting lists. So there's quite a few units there, 136 at Phase 1, 186 on Phase 2. Closed waiting lists. For those of you that don't know, we have two fairly large, well, they really aren't large, but they're high rises that are located just south of here. El Dorado and Mar Vista El Dorado are senior properties that are HUD funded and are operated by the Church of God. Those two properties have had closed waiting lists. El Dorado since 2017, and Mar Vista El Dorado was opened last year. So they don't take applications at this time. So that concludes my presentation on senior housing. You had asked what kind of waiting lists there were and what kind of what was out there in terms of senior housing. And I'd be happy to answer any questions.
Thank you, Commissioner Cornett.
Thank you, Madam Chair. One quick question is, I can see the amount, I can see the wait list. What I don't see is a rolling time. So what I was hoping we would see is, on average, it takes a person 3 years to get into something. That was the number that I was wanting to see, only because it helps me understand better. You know, you see 1,500 people with 138 units, you can kind of build in your head what that may look like. But then if people go into other places, what that rolling average would look like. I don't know if we have access to that information at all, but that was the one thing that I was hoping that we'd see, but I understand if we don't have it.
That question, Commissioner Cornett, it was Harry's staff and our front desk staff that contacted these complexes, and it is my understanding that they did not provide that information because it can vary from time to time. I did personally speak to the woman at KOCT, one of the managers there, and she said approximately a 6-month wait. It's really hard to gauge how long waiting lists will take. I know that for a fact with Section 8 because we've been, since I've worked there, we've been as low as a 1-year wait up to 8, depending on new funding and people applying. I don't know, Terry, if you have a comment on that since you were involved in the data gathering.
That question was asked, Commissioner Cornett. The reply was that they have no prediction as to when people are going to move out, and therefore more units become available. So that was the only reason they didn't give us a time frame.
Okay, well, I appreciate you trying to get the information because, yeah, it's just math. Thank you.
Yeah, you're welcome. And somewhat unusual is one of the properties, these last two, were not very forthcoming of information. We had to dig for it on their website. So I get the impression that they didn't feel like they needed to get any, they had plenty of applications. So, or they get plenty of calls.
Thank you again.
Thank you.
No more questions.
Thank you. Do we have any other questions? Okay, we'll start here with Vice Chair Walshaw, and then we'll have Commissioner Costa. Vice Chair Walshaw.
Hi, Angie. The last time that Marjorie took some of us commissioners on a tour of the senior apartments, the way that it was explained to us, because we did ask at every place we went to visit, and one of the things they said was, additionally, I mean, to what you said about they don't know when somebody's going to move out, what they do is they keep their list according to almost everybody that we talk to, and then they call every time there is a vacancy, and they find that a lot of people have either moved with family, or they've passed away, or they're off the list, or they can't reach them, and then it moves on to the next thing. I believe that we came up with it was anywhere between 3 to 5 years, and that still is quite a wait for a senior that needs housing. And the other thing I wanted to ask is, with our mobile home parks being bought up by billionaires, as we all know, is there anything we could be doing or should be doing to try to plan ahead for what that's going to look like in 2 to 5 years with the rate that we're going? I mean, we've lost, if you look at the numbers on how many rent control spaces are lost, some of the parks are 135 or more homes per park that are no longer on rent control. So I'm just wondering if we have any way to plan something for those additional numbers, because we're living with a very high percentage of seniors in Oceanside, a large baby boom population. And I know that rents are going up or HOA fees are going up at Oceana and other senior communities. And then Vintage 1 and Vintage 2, we've had at least 2 people come in to housing or to approach me anyway in the last year who are reporting that they're being requested to sign leases every other month or so with $100 increases without any expectation of an ending to that lease. So one 85-year-old lady that I referred to the city said that she's being pressured every other month just to pay an additional $100. And she said that the older residents seem to be being forced out so that they can raise the rents higher. I don't know. I don't know whether we have any say over what Vintage 1 and Vintage 2 are doing, because I think they're privately owned, but it just seems to me that we're going to have a bigger problem as far as senior housing, and it's already starting, and I'm just wondering if there's something proactive we could be doing.
Vice Chair Walshaw, let me touch on Vintage Point first. That has been an issue for a number of years. That is a privately owned property that received tax credits. And what that property, it's a for-profit organization, and they have definitely implemented the maximum rents. Some of our other nonprofit developers are less likely to do that, so they have implemented rent increases. The rents are based on incomes in the area, and as incomes have gone up, the maximum allowable rent has gone up. We could definitely take a look at that. I'm not certain that there really is something that the city could do. We have a lot of people with Section 8 vouchers in there. That probably would be the best thing to do, is make sure that we get all those folks on waiting lists for Section 8 vouchers. They do take the Section 8 program. And I know we have a lot of people with Section 8 vouchers in that property. In terms of the mobile home parks, do you have some suggestion? I guess I'm not quite clear. I understand what the issue is, but what do you think is going to be the ramifications of them doing that?
After talking to Mayor Weiss and some of our other council members, the only thing I've been able to come up with based on what San Marcos has done with having nonprofit parks there is the possibility that we could change possibly in lieu fees if we allowed a developer, instead of paying in lieu fees, or instead of building affordable units, because if they're building a $500,000 townhome, they're going to say that $350,000 is affordable. But that doesn't help a lot of our low-income people. So the thing that I was thinking is, could we ask, amend the language and the in lieu fees to allow a developer to donate a portion of the land to place manufactured homes on it. And then if the city could do kind of what San Marcos did and have some kind of a way to oversee it as a nonprofit, to create a nonprofit entity that would run them and keep the rents fixed. That way the homeowners would purchase the homes. The developers would only have to put in the cement pads and the utility hookups, and the city gets to count them as affordable units almost immediately, because that kind of housing is already constructed and can just be put down on the location. And when I talked to Mayor Weiss about it, his response was, "I don't see why not." So I'm just thinking, maybe we need to start looking at what that would look like, or if that's feasible. I don't know until we run numbers and talk to housing and talk to everybody that knows that kind of data, whether that's even a feasible idea. But I think at this point we're open to suggestions. We need to slow the erosion of our rent control spaces in any way we can. And at the same time, we need to be looking at where we're going to put people that do lose their housing over the coming years. So It's just an idea. I mean, heaven knows if anybody's got a better one, please tell us what it is, because I don't know.
Commissioner Walshaw, thank you for the suggestions. As we brought before you in a previous meeting, we will be going through a major revision of our inclusionary ordinance, and we'll be doing a public process where we'll be inviting stakeholders, and that would be definitely the time to bring up your suggestion for the inclusionary ordinance, if that's something that you would like to see added to the ordinance. In terms of what I'm hearing from you is resident ownership of mobile home parks or potentially a nonprofit owning that. That had been explored in the past by Marjorie Pierce, our previous director. I can't remember what park that was explored for.
I think it was Laguna Vista, and I know
think it
she
was.
talked to Millennium, which
That's
is the
correct.
entity that runs the ones in San Marcos.
So that idea was explored in the past. That's not to say we can't explore it again. I'm not 100% clear why that concept didn't work. Our previous director did reach out to a nonprofit that works with parks to pursue ownership, or the nonprofit owns it. I believe the model is that the nonprofit owns it. I'm not quite sure though. But we
Yeah,
certainly can explore it
it's a
again.
little more complex than just, waving your magic
It
wand
is.
and making it
It's
happen.
pretty-
But
it is complex.
But maybe I need to start talking to staff and some other people and putting some kind of numbers on paper that we can actually look at, because I don't, it's an idea at this point. There's nothing behind it. So I would need more information, and I'm sure staff would need more information before we could even propose it. Thank you, though.
Thank you. Commissioner Costa.
I'm just curious, I know that rents have gone up, and I'm a little bit shocked at what they are at Oceana that I've heard. What's the going rate for rents? You're talking about these places, and in general, how do they compare? What are we working with? When we try to help somebody, I think we need to know what it's going to cost for them to rent something.
Commissioner Costa, you're correct. The rents have gone up exponentially in recent years. HUD has increased our amounts substantially for our voucher program based on that. But the rents are, like for a one-bedroom in the ballpark, I'd say $1,500 to $1,700 is what we're seeing. It's pretty steep. You might find something less. So yes, for example, Cape Cod is substantially under market in the $800 range. But we have units that are in areas where traditionally it's been very inexpensive behind the high school, that are in the $1,500 to $1,600 range for a one-bedroom. It's gotten very expensive here. So we have some very expensive units right on the coast. They're pretty outrageously expensive.
How do you propose to help someone with a rent that high? I mean, we have a group that's going to work for the homeless, but you get a person that doesn't even have a house and probably not much in the way of savings. How do you help this person to achieve something like that? That's a lot of money.
Commissioner Costa, I think we need to look at a variety of solutions, which we are considering. We have to really keep an open mind. Some folks really may not be able to live on their own, so there's a possibility of shared housing. That's something that we're talking about. For some of the folks that you're describing, we really are going to need to have deep subsidies, and they're going to have Section 8 vouchers. There's no other way that they really could afford it or a project could pencil out. You're talking about, I'm going to talk a little bit about how much our subsidies are, but the subsidies are just very deep subsidies. For example, a person on Social Security with income of $1,000 a month should be paying 30%, ballpark $300. So the balance is the subsidy, which is pretty large. That's the reality.
Thank you. Any other questions? So I have just 2 questions for our seniors. Do they apply directly to the apartments? If anybody is interested in any of the apartments that you have listed here, do they go directly to the apartments and apply?
Thank you, Commissioner Williams. Yes, the person would contact the apartment complex directly. We do have information on our website with phone numbers on the housing page at oceansideca.org. That's the old website. Under housing resources, that information can be found. In fact, also on that website is a list of all affordable housing county-wide. There's a document that, so a person that's interested in these properties does have to do some legwork and contact each of the properties individually to find out if they have an open waiting list, what is their eligibility requirements, that kind of information. So that would be up to the person that's interested in the property.
Okay. And my second question here, because you said for Vintage 1 and Vintage 2, there are individuals that are already living there and that they may need to apply for Section 8. So if you have a senior that's living in one of these 2 apartment complexes who has not applied for Section 8, your recommendation is if the rent is getting high to go ahead and apply for Section 8 and the city can help them out?
Thank you, Chair Williams. Yes. My advice always is to keep all of your options open, get on any possible waiting list that you can. Unfortunately, we do hear people say, well, I may not be around when my name comes up, but you just never know. So I recommend that you keep your options open by applying for Section 8 and also contacting any possible housing solution. To apply for Section 8, you can visit our office at 321 North Nevada Street. We have applications there. You also may call the office to ask that an application be mailed to you. That's probably the best option. And we can be reached at 760-435-3360 for information about how to apply and the waiting list. The Housing Authority website is oceansideha.com.
Okay, that's perfect, especially if you're already in the housing.
Right.
And you get on a Section 8 housing list and some housing comes available for seniors, you don't have to go with the voucher and try to find a house. You're already there. Now you're just going to get somebody to subsidize and help you with that rent. So that's great information. Thank you so much for coming out and giving this report today, Angie. She's not finished yet. She has to give a housing report now, but that was some good information, and we really do appreciate that for our senior community.
All right. So at this time, I'd like to give you a little bit of an update of what is happening in our housing world. I've been around for a long time, and I've never seen anything quite like this. I'm sure all of you haven't either. But in our housing world, the good news is that we are receiving some additional funding. So these are opportunities that we have right now that we didn't have before to provide assistance. Sometimes money's coming out from the federal government without rules, and they're saying, oh, we'll provide you guidance later. We have received some funding earlier this year, I think it was May, and last week they came out with, well, this is how we expect you to report on it. So it's kind of strange times. We're trying to go with it. We're grateful to have this funding that we can help people with, but we're just trying to go with the flow. So my goal today is to provide you a little bit of an update, and I know I haven't included everything. Some of these programs we've talked about at previous meetings in terms of that we were going to get going with them, and some of them we just recently started. So I'd like to give you an update on these. So I believe we may have talked about this at a previous meeting. Under our Housing Choice Voucher Program under the CARES Act, we've received some funding related to COVID. In fact, quite a large number of amount of money, and it's changed several times since we've received three different allocations. But at first it was, we had to use the money by, I think it was October of this year. And then it was, first of all, it was December of this year. Then it was June of next year. And now it's, we have to use it by the end of December. So we're greatly changing daily or weekly, but we are grateful, as I said, to get some additional funds. For our Section 8 voucher program, we've received additional funds for administrative, and I'd like to tell you a little bit about what we're doing with those. We haven't fully planned what we're going to use these administrative funds for, but primarily they're to deal with implementing what we have to do during COVID. So the types of things that we've used money for so far is, if you haven't been in our offices, we've done a pretty big remodel. So that our previous model was that we had our front office staff was just open to the public, which I liked, and I'm sad that that's gone away because I feel like it's less personal. However, due to COVID, we did do a remodel. We also had staff that were working closely together. So we've done some remodeling in our offices so that staff have their own offices, and we never fully closed. We were closed to the public for some time, but we have been open to the public, at least in the lobby, for the last 6 weeks or so. But we never fully closed. We always have had staff in the office. But we've made these changes. So we're taking advantage of this or using this opportunity to do some different things that we didn't really have funds for. We are doing some IT upgrades. We are expanding our office space. If any of you have been in there before, we've been pretty crowded for a long time. In fact, we had housing staff working over in Parks and Rec and do right now. So we are expanding a little bit of our footprint of our offices. We don't currently have an online waiting list, so that's in the plans. We are, I guess, getting technologically into the current century. Terry's laughing. But we just recently implemented scanning, so we're moving towards paperless finally. That's been like on our docket for years. So those are some of the things we're doing with some additional administrative funds. We also have not been able to do most inspections since March, and so once we start doing those again, we're pretty far behind. So we are planning on either hiring someone to do those for us or hiring an inspection firm. There's inspection firms that do that. And we are also considering hiring some additional staff. COVID's been interesting. We've had a few people out for medical reasons. We have a couple of people that have had childcare issues. We've been short-staffed, so that's another area that we're looking at as maybe bringing somebody in. In addition, last week, we found out that we were going to receive additional housing assistance payments of $1,662,000, which is a fairly large amount. The reason for the need for that is that our average monthly housing assistance payments have gone up pretty drastically, $97 a month, $97 a month per household, higher than what we received our funding on. So that's what this illustrates up here. And I mentioned to Commissioner Costa, this is what our average HAP was in June, which is what we got our funding on, $1,228. So we're helping people that are fairly low income when we're paying that large of a subsidy. I'd like to talk about some other programs, the CDBG, Emergency Rental and Utility Assistance. Cecilia Barandaran came before you at a previous meeting to talk about this. We recently got the program up and running. Sorry. And we have now received 31 applications to date. and the applications are due by September 28th. This assistance is for persons that live in Oceanside that are renters with a lease agreement, and there has to be a clear connection between the financial hardship and COVID. So these are folks that perhaps got behind on their lease or on their rent and their utilities. There is a cap on the income for this program. The applications are available on the city website, oceansideca.org, on the COVID-19 resources page under Workers Resources. There are quite a few resources on the city webpage that I suggest, if this applies to you, that you look at them. I've also listed additional information. There's a phone number that can be called to find out more information about the program, 760-435-3600, and there's an email address up on the screen as well. We are expecting to send out the first notifications of the funds being granted tomorrow. So this is hot off the press, I guess. Through the CARES Act and CDBG funds, there are other programs that are up and running or were up and running, hotel motel voucher programs. The first one was the bridge housing expansion, and Salvador's already addressed that, so I don't need to go over that. We also have a Housing Authority hotel motel voucher program, and we are operating that within the city. And these are families that are displaced by COVID-19 with housing plans. And the way this program works, we are using a motel, and Sal has additional information if I can't respond to all of them. So the way this works is that families would receive case management, and they can stay at a motel for a maximum of initial stay of 2 weeks, and with a maximum of 4 to 6 weeks. This program began September 1st, and it's currently serving 9 households. One adult has already secured employment, and one family is scheduled to move into affordable housing on October 10th. There's that program that's up and running. Another program is that the city recently entered into a contract with Operation Hope for hotel motel program vouchers. And Operation Hope staff, who are located in Vista, are helping families and single women who are at risk of homelessness due to COVID-19. This program also recently began September 4th, and at this point they're assisting 9 adults and 3 children in 6 rooms. The next item is Project Home Key. This maybe should not have been exactly included with this, because this is a program that we are not going to be participating in. We received an inquiry from a constituent about participating in this program, and it's been in the news a significant amount. Project Home Key is based on Project Room Key, and that's the program that where the state allocated a lot of money for jurisdictions. Well, they actually allocated the money to the county. The county found motels and provided hotel motels for homeless folks to live in, or people that were at high risk of COVID. There were 2 of those. They were in North County, and one was in Escondido and one was in Carlsbad. We did not, there initially was planned to be one in Oceanside, but that ended up not staying a motel for Project Room Key. So Home Key was an opportunity for public agencies to purchase motels in response to homelessness. There was quite a bit of money for this, and staff carefully evaluated the application. It simply would not work for Oceanside after analysis. Number one, we don't have motels really in the city that would work for this project, that would be appropriate for the funding. The other issue is that the turnaround time was very challenging. the highest priority would be projects that could be occupied within 90 days from the date of acquisition and are permanent housing. So this really was, for the most part, intended for motels that were already working under Project Room Key. So it was, as I said, a very short turnaround. All the funding, most of the funding had to be expended by December 30th. But that was something that was brought up by a constituent, so I wanted to discuss that, or I was asked to discuss that. Another thing about this program is that it was not free. There was a match requirement, and so the city would have had to have put significant amount of match money into this project. So that was another deterrence to work with these funds at this time. And that concludes my presentation. I'd be happy to answer any questions on any of the programs or on Project Home Key.
Do we have any questions for Ms. Megan at this time? I just have one question, for Ms. Angie at this time. Do we have any questions, correction? Okay, I have one question, and this may be for Sal, but you may know the answer. Under the CDBG Hotel Management Voucher Program, you said effective September 1st, we're serving 9 households with vouchers. How many vouchers do we have?
But just so I understand the question, you're asking how many?
Can you go back to that slide, Angie?
Sure.
For the CDBG Hotel Motel Voucher Program?
Oops, I guess I can do it. This one?
Yes, that's the slide I'm referring to.
So just to clarify your question, you're asking me how many vouchers do we have for our program, the motel vouchers?
Yes.
So there is no specific voucher amount. It's just we have designated $100,000 from now to December to designate for vouchers. Some could stay a week, some could stay 2 weeks. It just varies. So it's not necessarily a number amount. We did allocate, if I remember correctly, we budgeted for about 10 vouchers per month. So it really is, it's going to vary on the people that we have. Some could stay longer. I can give you an example. We have one client who is a senior, and he's going through the POFA voucher process. And it's just taking longer. It's not his fault. It's just the process, and COVID has kind of extended that process. So he's going to stay that full month, and might be extended another 2 weeks until we get him housed. So that's an exception where he's done everything he could to get housing, and it's now just waiting on the system.
Okay, I'm not the numbers person, Commissioner Cornelius. I didn't work the numbers, but for the amount of money and for this program, 9 just seemed low for the hotel motel program, voucher program. How is this information getting out to the community that this program is available? Are you?
So the program is, it's not necessarily promoted as far as getting out to the public. It's been promoted through our partners, agencies, social services, homeless providers. Essentially what we do is we connect them with our resources so that we work together with their resources and kind of use that whole mentality of it takes a village. And this program is not necessarily designed for specifically the homeless population. It's just anybody that was affected. So we have families, we have people that just hit a series of unfortunate events and they don't have their job for the last 4 or 5 months, and they just need a couple weeks to get back on their feet. So it ranges from chronic homeless to working class, and it's anybody that has called the housing authority that is requesting some sort of shelter. Our social workers do a deep assessment of need, and if they are someone that's eligible, we definitely hook them up with the resource.
Okay, Commissioner, I would ask you for more questions, but I'm going to, Commissioner Cornett.
Piggybacks on yours. So the reason I didn't see it is it said effective September 1st. Was that effective September 1st of this year?
Correct. This is the motel voucher program
Okay.
specifically, not bridge expansion, not to be confused with bridge expansion.
Understand, but it's only been going on since September 1st of this
Correct.
year. Do we have any idea how many families will be able to support through it?
That will heavily rely on the capacity of our social workers to do the housing navigations, social integration if needed, and case management. We did lose a social worker in the month of September, so we're kind of at half capacity. We've onboarded a new one, so we expect to go on all four cylinders by the end of this month or October 1st.
Okay, thank you. Sorry about that.
Thank you. That's okay. Do we have any other questions at this time for Ms. Hannafin or for Sal? Thank you both for your time. Thank you so much.
Thank you.
Thank you, Chair Williams and Commissioners. We would certainly be happy to bring back information on where we are with these programs and how many we've served as we have been doing.
Yes, because the Bridge program also has hotel vouchers as well. Is that correct? Okay.
But the bridge housing is completed. That finished August 31st.
Okay. Yes, so we probably should get a report for the bridge housing and how many people we were able to house during that time, as well as a report, an update for this as well. This is interesting that we have a program like this in Oceanside and the community doesn't know about it unless they're going to an agency looking for a wraparound service, or unless the hot team, if someone is just going through the website and they're looking to see, man, I have COVID-19 and this has affected me and I'm about to be homeless, there's nothing on the website that would direct them to this particular program.
Yeah, so because we were short-staffed, we kind of wanted to do a soft launch of the program. Once we have completed the training for our social worker and she's gone through all the training that allow her to enter clients into the system, that's when we'll kind of do a hard promotion of it. But we did, that was the presentation that I provided was our numbers for our bridge expansion program. Okay. So through bridge expansion, we were able to serve, specifically for bridge expansion, it was 35 individuals. Obviously, we could serve a lot more because we had a lot more space. And we worked with Interfaith to kind of borrow staff from other departments so that we can have more ground coverage, because as I described in the bridge program, it requires 24 on-site services, and that's what the bridge expansion provided. We had someone there every day, all the time. We provided meals, we provided intensive case management, and that's the big difference between this and the motel voucher program. This does not provide the wraparound services. It does not provide the meals or on-site staff, because the design of this program is intended for anybody that's affected by COVID and who can be higher functioning, have their own car, can get their own food. They're down on their luck. They're affected by COVID, and the city's just here to help.
Okay. And when you say you could have served more if you had more space, meaning that individuals who were homeless in the city of Oceanside were not able to receive services from the housing authority because you didn't have enough space? Is that what you meant?
No, I'm saying we were able to be served more at the motel because we had more space. We physically had more space as opposed to the 3 units at the bridge apartments.
Got it. Thank you for clarifying that. Thank you so much. Okay, so we're going to now have the Veterans Administration update by Ms. Angie Hannafin.
Thank you, Chair Williams. I have been in contact with the VA. My ask of them was for them to talk about veteran homelessness in general, as well as within our county, and to speak about VASH. That's my understanding of what the request was. They were not able to come tonight, but I am anticipating that they will be able to either call in or attend the October meeting. There's been a change of staff as far as who we are assigned to at the VA. Person left, so that's the plan at this point.
And if they can provide a video update, and we can just drop the video down so the viewing audience at home, as well as we can just look at the video, if they can just give us an update.
Chair Williams, is what I described to you what you're looking for and what the commission is looking
Yes.
for, or is there something else that
Well,
you would like?
preferably, I'd like to speak to them in case I have any questions.
Okay.
So I don't know what type of technology we have here to be able to put somebody on the screen for us to be able to, for them to give a report and for us to be able to give them questions. Do we have that technology here at the City of Oceanside?
Is it up and running already? I don't know. I know they're planning on it.
I believe so, and if Andy can hear me, he may be able to address that.
Okay.
Andy?
Maybe Megan knows.
Chair Williams and Commission, the city is working on a Zoom platform for meetings for both council and the commissions, but we don't have a specific launch date just yet. But
Okay.
we are looking for that in, I would say, the next 30 to, in the next month or two.
Okay.
It should be ready to roll.
Okay, thank you. I think that would be great. Okay, the commission agrees with me. Thank you, Angie.
Chair Williams, may I say one more
Yes.
quick thing on my report? Just a reminder that we're nearing the end of the census reporting or census application. So it finishes at the end of this month. So please make sure that you've completed your census. It's extraordinarily important in determining the amount of funding we receive for the programs in the city of Oceanside. Thank you.
Thank you so much. So we're going to now go down to our reports, and we'll start with the chairperson's report. Earlier, we voted in the Dr. Martin Luther King Jr. Community Service Award Selection Committee, and so that application will be available to the community the end of the month. We're going to put it on the city website. If there's someone out there who you think should be nominated, it could be a person who's doing a lot of work in the community who's not necessarily recognized. It could be someone who's working with a nonprofit. We'd like for you to, we're going to be soliciting nominations for that individual to be recognized by the City of Oceanside for the, to be the 2021 Dr. Martin Luther King recipient of that award. And so we'll hear a little bit more about that, but by the end of the month, that application will be up on the city website. I'm encouraging everyone to go take a look at that application and start thinking about individuals now who you can nominate. There's a lot of people that's doing a lot of work within the community of Oceanside, and sometimes it's just good to be nominated and to be recognized for the work that you do. And the only other thing I would have to say is this is an election year. Voting is on November 3rd. We're encouraging everyone who has not already registered to register to vote and vote. You can actually go to sdvote.com, that's San Diego vote.com, to register to vote. And I invite you to take a look at their website because they have a lot of other information available to you on that website. And now we'll have a Vice Chair Walshaw report.
Good evening, everybody. And to tie on to what Inez just said, I got an update yesterday from the League of Women Voters, and they have their ballot summaries up. So if anybody wants to sort out what the ballots are about and the pros and cons of each one, the ballot initiatives, I should say, excuse me, you can go to the League of Women Voters website and see all of that there. And they usually have, I don't know if it's up yet, but they usually also have like candidate profiles and things like that. So it's very helpful information. I usually get a lot of calls closer to the elections about, the ballot initiatives, about the judges, and the more things that are not so prevalent in the news every day. But the League of Women Voters does a great job of posting information so that you can see the pros and cons of each issue pretty clearly. And the other thing that I was told yesterday is that there's going to be an online panel discussion on senior issues and rent control issues in Oceanside on Friday. I have not yet been provided a time. I think it's going to be a Zoom meeting that's, where the public can sign up and log on. And as soon as I get more information about it, I will send it to Angie and Terry so they can distribute it to all the commissioners and anybody else that's interested. Hopefully, I'll have it by tomorrow, I hope. So thank you all.
Thank you so much. Commissioner Costa.
I've been concerned about the homeless with all the different problems, and I have come up with an idea. There's a building in Oceana that's not rented fully 90% of the time, and there's another big sign outside for rent. And there's a program in Ohio that I did some research on where a homeless person, in order to go into a place, would have to have a plan of action to get out of homelessness, how they would tailor their life, what courses they might take, what they would have to do to leave the place, have their job, and be able to get an apartment or a home. This place is a big professional building, and it could I don't know, I haven't really seen the entire inside, but for a building with professional offices, it might be possible to have studio apartments without a kitchen. And as you were saying, have somebody there 24/7, a major conference room or something to be able to feed them, a social worker to help them on their path in their job. But they would have to be tested for drugs that they weren't on drugs. This program in Ohio has been in place for 22 years, very successful, and it just sounds like it would be something good for Oceanside. So when we get our homeless team together, maybe we could investigate. Would there be money to rent a place like that, or would we have to come up with it? Does anybody know?
Commissioner Costa and Commission, that's actually very timely with regard to the request for proposals and notice of available funding. So anybody listening, or if there's nonprofits or developers or anybody that wants to consider that location for one of their proposals, that's something that they could look into. But at this time, we're looking for those proposals to come into us, so how the city is responding to creating a program or a location is to issue this RFP and let the service providers tell us what their proposals are and locations.
Okay,
And that's where we're going to direct our funding, yes.
All right, so I think you're going to get additional.
I think to address the overall idea of what you're talking about, I think our director is being a little bit modest, but everything that the direction that she's given, the direction that the housing division is heading towards is everything that we're doing is housing focused. So tying back to what you're saying as far as they have a plan, we are working to design our program so that there is short-term, intermediate, and long-term solutions. And in that, it's always going to be housing focused. They may not be ready the first time, second time, but when they are, we're going to hook them up with the second step, and so on and so forth. So from the beginning to the immediate solution, all the way through the end, everything's going to be housing focused, and that's kind of the mentality of what we've been working and operating under. So using that and using the data that we have that's been provided through our service providers, we can be strategic in our approach.
Thank you.
Thank you.
Sal, thank you, Megan. Commissioner Cornett?
Very quickly, for those that may not know, the days that we're in are the days, the holiest days of the Jewish calendar between Rosh Hashanah and Yom Kippur. They're known as the days of awe. They're specifically designed to allow those of us of the Jewish faith to requests from those that we may have harmed knowingly or unknowingly, purposely or without thought, to apologize for those transgressions. It is up to other people to forgive us. And within that, it's more importantly a time to reflect on how, in Hebrew, it's called tikkun olam, which just means to repair the world. And the work that we do here is truly that, because we're looking to help those people who sometimes can't help themselves. So I also want to thank you for allowing me to serve on this commission and remind people that it's a time of reflection. So whether you follow the Jewish faith or not, any time that you can grab an opportunity to reflect is never a bad thing. So I just wanted to wish those in our community who do celebrate Rosh Hashanah and Yom Kippur an easy fast next week.
Thank you so much, Commissioner Cornick. Commissioner Howell?
Well, I have nothing to report at this time.
Thank you so much. We're going to go to our commissioners on the telephone. We have Commissioner Keller. If you can unmute yourself, push *6, Commissioner Keller.
I had to unmute myself. I do apologize. So I know someone had brought up the League of Women Voters. Actually, their vote411.org is actually available. You can check your registration. You can check what's on your ballot. And they even do a breakdown between candidates and propositions. So that is very much available for individuals who are looking to get that information and who are doing early voting right now.
Thank you. Does that conclude your report?
Yes.
Thank you. Commissioner Webster.
No, I have nothing to report at this time.
Thank you very much. Commissioner Whip. Commissioner Joe Whip, do you have anything to report at this time?
No, nothing to report this time. Thank you.
Thank you. Commissioner Sherry Shaw, do you have anything to at this time to report at this time?
Not at this time. Thank you.
Thank you so much. So we like to set the agenda for our next regular commission meeting. And so we're going to adjourn tonight's meeting to October 27th at 6:15 p.m. Meeting adjourned.